I have been visiting many hospitals throughout Malaysia, and I found that patients and even clinicians have not heard about patient blood management. Can you explain what patient blood management is?
In simple terms, patient blood management is looking at the patient as a whole and highlighting patient's own blood as a valuable and precious resource, which is like a gold. So all kinds of measures are taken to manage and preserve it while engaging the patient in decision making. Hence, we must remember patient blood management is not a transfusion safety or transfusion medicine. And patient blood management is not about critically ill patients or hospitalized patient, or to those who needs blood transfusion. Patient blood management is not a laboratory-based or device-based or even drug-based. Let me ask you, do you know how PBM works?
Well, since I love cooking and hosting, let me relate patient blood management to that. To host a good dinner, one needs to be prepared. And of course, I need to know how many guests are coming for dinner. Then I have to make the best of the food that I've prepared so that all can enjoy. Likewise, the 3 pillars of patient blood management: building the blood, reducing blood loss, and supporting the patient. All surgical procedures need to be planned. Any anemia or iron deficiency need to be corrected. Blood thinners withheld to reduce bleeding during surgery. Meticulous surgical techniques to reduce blood loss. And specific anesthetic procedures to optimize the tolerance to anemia. Well, I know that patient blood management is good, but I have a hard time convincing others about its benefits. Can you bring that to the fore?
If you have a choice, would you choose a cure and a better outcome in comparison to a transfusion which is going to cause harm or just temporary measures?
Of course, a cure and better outcome.
If I ask you again, if you're given an option between a cheaper and an expensive option, which one would you choose again?
I would choose the cheaper option.
Exactly. Patient blood management offers cure, promotes good health, improves productivity, and excellent outcome, which can be very cost effective, as opposed to blood transfusion, which can cause harm and also very costly, as in like 1,000 ringgit per bag. I still don't understand why so many people out there do not want to practice patient blood management. Anyway, to those who accept patient blood management, they will benefit from it. Oh yes, do you have a checklist as of when to request patient blood management?
Yes, I certainly do. I have it right here with me.
Thank you.
Patients should request for patient blood management if they are anemic or are told to have a blood transfusion. They should also request for patient blood management if they have underlying chronic diseases such as kidney disease, heart failure, cancers, or any underlying bleeding disorder. And also if they are pregnant and they are undergoing surgical procedures. And prior to that, they need to ask the clinician, what is my hemoglobin level? Those who are undergoing chemotherapy or cancer therapy. The best blood is your own blood.
Please ask for and practice patient blood management. Thanks for watching.
Hello, doctor.
Hello. Please have a seat.
Thank you.
May I know your name, please?
My name is Nadira.
Do you know that you are scheduled for a hysterectomy in 2 weeks' time for fibroid removal?
Yes, I was told by my gynecologist.
You know that this is a major surgery in which you may bleed during the procedure and require blood transfusion. So you have to sign a consent form for the same.
By the way, doctor, may I know what is my hemoglobin?
Oh, let me check.
Because I've been feeling very tired lately.
Your hemoglobin is 10 grams per deciliter.
Is that considered low, doctor?
Yes. For ladies, there should be minimum of 12 grams per deciliter.
Is that why I'm feeling tired lately?
Yes, it is one of the possible reasons. This is another reason why we would require your consent for blood transfusion, because you may require it either during surgery or soon after that.
I would rather not to have a blood transfusion. I've heard about the dangers of blood transfusion, and the best blood is my own blood. I want patient blood management.
I thought we usually top up with blood before sending patient for surgery. What is this patient blood management?
How good it was that I followed the program on patient blood management. I must keep learning.
Okay, I will check with my colleagues about patient blood management and I'll get back to you soon.